Welcome back to the show, and this morning we are joined by Temitope Alaosani, a registered dietitian and nutritionist with over 5 years clinical experience in the dietetics profession and a proven track record in evidence-based nutrition education and counseling. She is a full member of the Nutrition Society of Nigeria and the Association of Nigerian Dietitians. Tope is passionate about improving the health and well-being of people and individuals, and today we will be talking about nutrition, preconception and fertility. Good morning, Tope.
Hi, good morning.
Hi, good to have you here.
Thank you for having me.
I mean, before we came on air, we're talking about the topic, and my colleagues are already going. They were going.
Yes.
Yes. So, nutrition, preconception, and fertility. I'm very moved to ask this question. Are you saying that before a lady starts thinking of conceiving, she should check out her nutrition?
Yes, that's exactly what I'm saying.
Okay.
And, you know, in the society we find ourselves today, that's not common.
Yes.
And I feel like that's part of why we have such a high or alarming rate of infertility among, you know, couples, because many people are not paying attention to the stage that they are before they get to the stage where they, you know, are trying to, you know, have babies or trying to conceive. The preconception stage is so important because the conception stage actually depends on what happens during the preconception stage. Many women are, you know, unaware of certain conditions that they have until they start to, you know, try to conceive. Many women are deficient in iron and they do not know. Many women are, you know, living with nutrition-related diseases like PCOS. They do not even know about it until they get to the point where they're trying to, you know, have a baby, and then they're like, okay, let's take this test and that test. But, you know, if you're already putting into consideration your nutrition, which obviously puts in your weight into consideration, you know, it puts in other related, you know, issues that could arise. If you're already tackling it before you get to the point where you're trying to conceive, it could actually make a huge difference. Because at that time, you're already making efforts, you know, even before you get there. Exactly.
Now, I want us to be very detailed about this, but we don't have so much time, so I'm just going to give you like pointers so you direct it. So now, for a lady who is thinking that, okay, I'm going to want to try to conceive in the next 6 months. So now we're in the preconception phase. So what are the things she needs to add to her diet? What are the things she needs to be careful about in her diet, just so that for a base preparation, she needs these basics? What are the things?
Yes. So it all comes back to, you know, healthy eating, a holistic, you know, approach. So that's not the stage where you want to try to eliminate a certain, you know, class of food or a certain type of food because you read something about it or because it works for somebody. You want to actually embrace a balanced diet. You want to eat your fiber, you want to eat your nuts and seeds. You want to also consider, you know, even testing yourselves for, you know, this, I mean, something like PCOS, like I mentioned. So many women are also living in fibroids and they do not know. But when you're eating foods that are, you know, anti-inflammatory, things like, you know, your ginger, your garlic, you're eating those things as a routine. You're eating it as food. You don't have to now, you know, start to take it as medicine, because at that point, you know, you already know that, okay, this is something that you've been eating. So eating, you know, your nuts and seeds, making room for it in your, you know, regular rice, in your desserts and, you know, everything like that.
So by nuts and seeds, you're referring to the almonds, the pistachios and the rest?
Cashew nuts, you know, groundnuts. You know, make room for all those things, including, you know, your regular foods. And, of course, fruits and vegetables. We cannot overemphasize it. Colors, I always say colors. Try to look for ways to put colors in your plate. When you're eating rice, is white. When you're eating yam, is white. Get a way to get the peppers in it. It's red. Get a way to get, you know, your cucumbers, your oranges in between meals. It really, really helps a lot. Okay, now,
it's good that you brought PCOS, because I do have friends who have discovered this, and fibroids as well, and it's like an alarming rate now in our society. So now let's assume that we've gotten to the point where this has been discovered, and now this lady is trying to conceive. How do you work in your nutrition at this point? How do you improve your diet to be able to conceive, considering all these factors that are already on the line?
Yes. Okay, so when it comes to things like that, it's highly individualized, because what works for A might not necessarily work for B. But then it's important, like I said, to, you know, consider if you have somebody who has, you know, high blood sugar or, you know, things that have to do with sugar, you want to look at your diet in that, you know, in that guide, in that light. You want to, you know, check out foods that, you know, have lesser glycemic index, you know, things that are high in fiber that will keep you full. And if you are overweight, you want to try to consider losing some weight. I mean, it's not about the more work, more results. No, you want to look at where, you are able to strike a balance, where your body is able to function optimally. For fibroids, I mean, it's something that has to do with inflammation. Again, you want to try to include all those anti-inflammatory foods like your ginger, your turmeric. You want to try to include all those things in your diet, in your food, while you're cooking, into your smoothies. Just try to look for a way to get them into your food. It helps a lot.
Okay, well, this has been really educative. Thank you so much,
Thank you so much.
And I hope we're still having you next week. Please, we have to have you because we need to talk extensively about this. But just for the benefits of people that are watching, before we let you go, now let's do. You know how I like to do an ideal meal.
Yeah.
Now, so an ideal meal for a lady who is at the preconception stage. So, what should an ideal meal be? I know you said balanced diet, but just give us like beans, vegetable. Let's have an idea.
Okay. So that will also again depend on that individual because sometimes adequacies vary.
Okay.
Some people are deficient in, say, iron. Now, this kind of people, they need to make sure that they are including, when they're including vegetables, you want to choose those ones that are higher in iron. When you're taking fluids, for instance, something like Zobo, I mean, you want to try to, take Zobo sometimes instead of your sugar-specific beverage. And it also has vitamin C. So that way it helps you to absorb the iron that, is coming from your food. So for an adequate meal, you want to look at your carbs, of course. You want to look at your healthy carbs, your complex carbs. Fruits, vegetables, even rice. I mean, that's also fine. You want to add some, pulses, legumes like beans, different kinds of beans. Doesn't even have to be the brown beans. Then you also want to make room for your protein, your plant protein, your meat, your eggs, or even plant proteins, not just animal proteins. Yes. So you want to look at those things, and then of course healthy fats. You want to cook with little amount of fat, and of course choose from the ones that are unsaturated instead of saturated. Yes.
Thank you so much, Tokwe. It's always a pleasure having you. I am sure you have learned more than a thing or two about diet, preconception, and fertility. You can go on our YouTube page to grab more information about this, or drop your comments on our Facebook, Twitter, or Instagram at TVC Connect. But we have MM standing by in the kitchen.